Welcome to SYMHEALTH 2022. I, Neha Raghu,
And I, Vinay Dhadich,
congratulate the students for their commitment to professional upgradation by way of enrollment and successful completion to the various programs offered by the Symbiosis School of Open and Distance Learning under the aegis of Faculty of Health Sciences, Symbiosis International University.
Diploma in Hospital and Healthcare Management, Diploma in Medico-Legal System, Diploma in Quality Management of Hospital and Healthcare Organization, Diploma in Hospital Planning and Design, Diploma in Health Insurance Management, Diploma in Health Communication, Diploma in Medical Tourism, Certificate in Infection Control and Patient Safety, Certificate in Disaster Management for Hospital and Healthcare Organization.
Please note, on both days of the campus contact session, at the end of academic sections, photograph of Symbiosis School of Distance Learning students shall be taken. All are instructed to mark their attendance by being present for the group photograph at respective venue as per the following. For the track 1, here at Moringa, people present here at Faculty of Health Sciences foyer on the steps. Please note that full attendance on both days is a mandatory prerequisite as a proof of attendance necessary for confirming eligibility as per statutory norms. Hence,
Recording in progress.
registration on both days and presence during group photograph at the end of individual's day's proceeding is mandatory. And I request everyone present here to put your phone on the silent mode. I kindly repeat, whoever present in this auditorium, kindly put your phone in silent mode. For pre-conference symposium, all the delegates are requested to register on 22nd April 2022 at cafeteria near Faculty of Health Sciences foyer as per your registration number. Seating in academic track 1, 2, and 3 venues will be strictly on first come, first serve basis. If you're late for the selected track, then late corner shall be accommodated in any other available track. There are total 3 academic tracks, and that will be conducted parallel. Registration of delegates for tracks will be done exclusively on first come, first serve basis. Delegates and everyone present here today, I, Neha Raghu,
And I, Vinay Dhadich,
students of MBA, Hospital and Healthcare Management from Symbiosis Institute of Health Sciences, on behalf of Faculty of Health Sciences, Symbiosis International University, welcome each and every one of you to the pre-conference symposium of SYMHEALTH 2022, National Conference on Transforming Healthcare, Symbiosing with Allied and Healthcare Professionals.
progress is impossible without change, and those who cannot change their mind cannot change anything. Coming together is a beginning, keeping together is progress, and working together is success. Over the coming day, too, we have lined up several exciting sessions which will cater to varied interests of all our delegates. We are sure that these 2 days would be a great learning experience where you would be able to interact and get a broader perspective of healthcare industry.
It's no secret that the healthcare industry faces some unique challenges when it comes to workforce management. The mere nature of the job creates high stress positions that can lead to early burnout. There are numerous challenges which plague the human resources in the healthcare industry.
This session will focus on the major issues along with current trends being adopted.
Let me introduce the first speaker, Mr. Sunil Karanjikar, Director, Human Resource and Employee Relations, Jaslok Hospital and Research Center, Mumbai. Sir was the Chief Human Resources Officer at Ali Khan Health Services. He was the General Manager, Human Resources at Apollo Hospitals. Sir worked as the Assistant Vice President, Human Resources at Nanavati Super Speciality Hospital. Now, I would like to invite Mr. Sunil Karanjikar to the dais.
Good morning to you all. My name is Sunil Karanjikar and I represent Jaslok Hospital as told by the student in my introduction. Both the students, I don't know the name, but they were very generous in introducing me. And before we start the session, I would like to give one message to you all is that nothing worthwhile is ever achieved without deep thought and hard work. My presentation will have two parts. One is the workforce challenges, and second is the key or newly areas through which we can tackle the workforce challenges. I'm sure this is the first session of the day, and you will not get bored. I will ensure that you will not get bored. Question answers we will have at the end of the sessions, but in between, if you feel that you have some critical issue, you can raise your hands up. So, shall we start with the presentation? So, my first three slides will be general slides, which talks about healthcare worker, who are healthcare workers. Second is about the statistics of the country. And third is about what challenges we face. And then thereafter, we will have 7 challenges and then newly trends in the industry. So basically, when we talk about healthcare professionals or healthcare industry, there are 3 different areas which we cover. One is the support service, which includes your housekeeping, class 3, class 4, or support service like finance, accounts, administration, then human resources. The core healthcare professionals are those who really work for patients on the floors, and they are basically doctors, nurses, and technicians. I would always give first preference to the nurses because they are always there 24/7, and doctors are coming and going within 15 minutes, right on the scribble pad, what they write, they only understand. Though I'm working for 15 years in healthcare industry or more than that, I have never understood why doctors like that. Okay. So basically my view is that nurses are the main healthcare professionals on the floor because they spend almost 8 to 10 hours. Doctors, and then the technicians who take your X-ray or maybe CT or MRI or nuclear test, other things. The other sectors are various other sectors which support to the entire ecosystem of healthcare, and they come under that category, for example, insurance company. The second slide talks about the distribution of health workforce across the urban and rural area. If you see, the blue part is the rural and the red part or the umber color part is the urban area. And this is the statistics which was collected by the government in the year 2018. Thereafter, there is no statistics published by the government. So basically, there are 6 categories which I have shown over here in my presentation. One is the doctor, second is your dental, third is Ayush, nurses, others, and total. Now this is statistics of 2018, and thereafter there was no statistics, as I told. But if you see this particular chart or this particular bar graph, it shows that 53.55% or maybe 54% of the healthcare workers, they are in rural areas. Now, why I am giving a thrust on this particular column is basically because the healthcare infrastructure is missing in India, in rural area as well as in urban area. So what urban area people do, they don't go to hospital because of the income also. That is the second reason. And they get treatment over here, and that's why the number of doctors or paramedics or others who work for the hospital industry, their numbers in rural areas are high. But there is a drawback to it, and there is a flip side to it. The flip side is these people, no offense, but these people particularly cannot treat a critical disease in the rural area, and which results into load on the urban area. Now this I wanted to highlight, that's why. Otherwise, and why I wanted to highlight, basically because the infrastructure in this country as far as healthcare is concerned is totally imbalanced. And when there is some imbalance, the problems are going to start, and problem will start. Only because of this COVID situation, government has woken up like anything, and they are declaring various schemes. Nothing against government, because government was supposed to provide this long back. But this is a very worrying factor because here no critical illness can be treated. Critical illness will be treated only in urban area where also the numbers are 46.45. And if you see the population of India, this much, 90 crore in rural, 42 crore in urban. And when they come from rural to urban, there's always a pressure load on the hospital, whether it is a private hospital, whether it is a charitable trust hospital, or whether it is a small nursing home. But the entire load comes on the urban infrastructure, urban healthcare infrastructure, and the system collapses many a times. Government hospitals, you know the situation of government hospitals, how do they conduct and how do they treat the patient. They might be giving a good treatment, but that is through a doctor who is dedicated towards his patient. But at the same time, if you ask me the infrastructure, again in urban area it is pathetic. So we need to do something as a part of healthcare industry delegates who are sitting over here, as well as students who are going to pass out and then take up the jobs in healthcare industry. If we all concentrate on all these points and specifically the imbalance in rural and urban area, then definitely I'm sure that this Vasudhaiva Kutumbakam, what Symbiosis talks about, will be the reality in future as far as at least the healthcare sector is concerned. Now, this is my third slide, which I said that first three slides are not a rocket science. Thereafter also there is no rocket science. But what is the workforce challenges and why we face the challenges? Basically because if you read, delivery of quality healthcare is a fundamental right actually in our country. Across the globe, it is a fundamental right of each and every individual who is staying in that country. And that also a quality healthcare treatment is very, very essential, which is lacking. In Corona, we have seen, I don't want to give the Corona example because it was an exception, but I'm just mentioning that basically because you all have seen on televisions and read in the newspaper what was the situation during second wave of COVID. So everywhere, people expect the quality treatment and it is their fundamental right. But we are missing in providing that. And why we are missing? Because there are various challenges. And those challenges, unless we address, and it starts for students from this stage when they are studying. So when they will go to colleges, the hospitals, they will have to concentrate or improve the system or try to improve the system. These are the 7 challenges which I feel are facing by each and every hospital, each and every healthcare professional. So start with growing population of the country, changing disease profile and re-emerging diseases, for example, COVID, lack of absence of infrastructure both in rural and urban area, paucity of manpower, specifically doctors, nurses and paramedics. Here is a problem in our country. There is only one state which takes care of the nursing education really from the bottom of their heart. Whether it's X government or Y government in that state, if you see, Kerala is that state which gives maximum number of nurses to this country as well as to other countries across the world. So this is one area of concern. Doctors, of course, we are facing problem everywhere, not only in rural but in urban also. Employee burnout, which is a major cause because of which many times doctors leave or nurses leave. Sometimes they take break and they start. Sometimes they take break and go abroad because abroad the situation is totally different. Their working hours are specific and beyond that they don't work. Here people work to earn the overtime or maybe compensatory off. So somewhere our system of addressing the problems of healthcare industry has to be taken up by the government, and government has to have some resolution, and tomorrow Union Health Ministry is there. Definitely students, delegates and the college will give importance to this and communicate to the Union Health Minister. Employee turnover and workforce mobility is the sixth point, which is also causing a problem and which is also one of the challenges of healthcare industry. And last, workplace transparency. Now here there are many things which plays a vital role in retaining your talent, whether it is a doctor, whether it is a nurse, whether it is a technician, whether it is a person who is working in the back office. Because if you see, majority of hospitals are focusing only on two things. Whenever layman thinks about hospital, he thinks about only two things. One is doctor, second is nurses. Nobody thinks about you who are in the administration side or on the support side or on the back office side. That results in the attrition rate because there is no transparency. The hospital will keep on talking with doctors. Ultimately, yes, there is a reason also, but there is a limit to which you can go and always consider doctor is saying yes and management staff is saying no. So these are the 7 challenges. We will go into the details of these 7 challenges. The first challenge is growing population of this country and which will never be controlled. You bring any law, you bring any government, but this challenge is going to remain throughout the life cycle of anybody. Now, why I have mentioned this point? This point is basically mentioned because the older population, they are living longer, and that is basically because of the medicines. The advancement in the medicine, the advancement in the treatment given to the patient, and which is good, of course. People should have a healthy life, whether with the help of technology, for example, a kidney problem. Person goes to dialysis, he gets some relief or she gets some relief. But that is very important. So development of the technology is not against the human being. It is in for the human being, or it is for the human being. But the healthcare industry professionals face a problem because then what happens? There are many older people, I have seen in Bombay and Delhi particularly, that they get admitted only because they are old, they are having XYZ problem. Nobody is there to take care at home, or even if somebody is there to take care at home, they don't want this ill person or the sick person to be at home. They are ready to shell out the money and they admit the patient, and patient remains in a hospital for 1 month, 2 months, occupying the bed. This is causing a problem for the hospital industry. Living longer. Now here, if you ask me, the pharmaceutical companies have done a good job, or their other research centers have done a good job. But this living longer puts pressure on the healthcare industry because we have a very limited number of resources in this country, and at the same time infrastructure is also very poor, and these two categories which I mentioned, older and the living longer, it is almost one and the same, will always go to hospital and will put the burden on the hospital infrastructure. They have a fundamental right to get the treatment, but sometimes I have seen in Mumbai, I have worked in 6 different hospitals. I have seen people getting admitted for months together. There is no reason. Why? Because my son is not taking care, my daughter is not taking care, I am feverish, I am okay when I come to hospital, I feel better. All those things put pressure on the hospital infrastructure. Average lifespan of Indian is now 70 years. Earlier it used to be somewhere between 55, 56. Now 70 is an average lifespan, and that results into again the burden on the healthcare professionals or healthcare institutes. If somebody is working in the hospital from this group, he or she will be in a better position to understand that what I am trying to say. Fourth point, India needs at least 1.8 million doctors, nurses and midwives. But where are the colleges? There are no colleges, hardly any colleges. This I have seen one of the biggest symbiosis, Then thereafter, I think DY Patil is there, but hardly few colleges in and around the state of Maharashtra, or even for that matter, across the country. Now what happens, why I mention this point? The load again is the same of the number of patients, and you must have heard that during last 2 years, the number of patients got admitted in hospital or in those big tent, tambu, whatever you call it as, were beyond the imagination. And that results into burnout of the doctors, of any healthcare professional, whether he is a support service professional, whether he is a professional directly giving the treatment, or we call it as a core person who is giving the medical treatment. Recruitment new employees and retaining existing employees is the biggest challenge. And I face that every day, because my target in Jaslok is to appoint, or rather to keep the limit, the threshold limit of nurses 510. I always face a problem. My team always face a problem. As the entire hospital, we all face a problem. Basically because nurses come and go within a year's time, because they are more interested in going abroad, whether UAE country, Ireland, or London, or UK rather, I'll say. So even if you do a lot of things for them, like employee engagement activity, every time you cannot give money and try to retain the person. No, that's not possible, and that is not fair also. So retaining them is the biggest challenge in the industry right now, and I don't foresee that this challenge will get over or will stop within next 5 to 6 years. It's not at all possible. Now in Gujarat state, government has opened some more medical colleges. In Maharashtra, no news, nothing announced by government, but if we do not have sufficient doctors, if you do not have sufficient nurses, then healthcare sector is going to face a big challenge as far as the manpower availability is concerned. And when you don't have manpower to treat the patient, you will always refuse to take the patient. That results into violence. And though there is a law that you cannot argue with the healthcare professional, Indian mentality, you know all, they will keep on arguing, they will hit the doctor, and all those things keeps on happening. The only solution is we should have sufficient people to treat the patients, and we should have a proper infrastructure. So these are the challenges which I have started talking about. This was the first one. We will go to next. Now, changing disease profile and re-emerging of the diseases, as I told, COVID. But there are many other diseases which goes, bird flu, which was there once upon a time. Recently, actually, not only once upon a time, recently. Again, it has emerged, it has gone. We don't know what will happen next. And the disease patterns are changing. When the disease patterns are changing, the technology sometimes doesn't support, because there is no technology developed in India or adopted by the Indian hospitals. Majority, I am not saying all, majority, have not accepted the new technology to treat the new diseases which are coming nowadays. There are various diseases I have seen in hospital while talking with doctor or their doctors or during the conferences, that people are coming with different type of disease, there is no treatment available. Now then doctor tries some method, he do trial and error thing, and then the patient, that is he or she, whosoever is the patient, gets treated. But if we change the technology, we adopt the technology, the hospital staff will be at ease to treat the patient, even in case of this changing scenario of diseases. So this was second challenge which I have mentioned. The third is lack of infrastructure, which I discussed in my preface. You know, even in city of Pune also, you must be finding there are hospitals, big hospitals, medium hospitals, large hospitals, charitable trust hospital, government hospitals, and some private nursing homes and all. But if you see the infrastructure they are providing to the patient is not, I will say, up to the mark, but not in all cases, in some cases. Now, people come from Pune to Mumbai for treatment. Sometimes Mumbai person goes to Chennai to take the treatment related to heart, maybe related to eye. Because these are the two areas wherein people generally go to Bangalore or they go to Chennai. Now, why that is happening? That is happening basically because in a city like Mumbai, there is a place problem. You can go only vertically, but vertically managing the hospital is too difficult because the manpower goes up. For example, I will give my hospital example, that is Jaslok. Jaslok has a 20-storied building. Now, you can imagine a person coming and want to admit, and we are sending him to 20th floor room. It becomes very difficult. Logistically, we manage, but time, it's a time-consuming process. Though we have systems, we have a quality department which takes care of and addresses various issues related to the turnaround time of the admission of patient. But space is a big issue. Whereas in rural areas, there is a huge space. Now government has put restrictions in the city of Mumbai that you cannot go beyond 9-storied building. Earlier it used to have up to 25 for hospital. You can imagine the fire brigade ladder cannot go up to 20th floor as of today, and hospitals we are constructing up to 25 storied. But fine, that is not a topic for the discussion today. The dearth of place and workstation. This has happened recently in last 2 years. If you have seen, the vaccinations were given to the citizens of India at different places, even in those small Shamiana sort of thing in cities like Pune, Mumbai, any city for that matter. Basically because government has never bothered to address the challenge of place, and that's why these workstations, we call it the workstation, where the vaccine was given to the citizens. Those pendals or those shamianas were on the road, in some Mangal Karyalaya, in some hotel, and all those things. But that is a failure on the part of government. Government will definitely take care of that, and government has announced recently that we will have 1100 hospitals across the country. When that will happen is a different thing. But our challenge as of today, for all of us, whether you are a student or a delegate or working somewhere, the challenge is the place for the hospital. There are hospitals, but then the capacity increasing is a difficult thing. Paucity of manpower, which I talked about, I think this is the fourth challenge. We have seen, I have seen that there are a lot of openings. Even in my hospital, other hospitals, people call up. Right from Pune, people give a call that, do you have this person available? Or do you know somebody in the industry who can come and join in our ICU because we are facing a problem in ICU? And majority of the hospitals face problems in two main areas. One is nursing and one is doctors. And if you see, recently people tried to literally snatch doctors from one hospital and put in another hospital. Government has done that. During last 2 years, what government has done is they have taken people on contract for few months, 6 months, 7 months, 8 months by giving a very high salary. Whether they have been paid or not, or whether they have been paid in time or not, is a different thing. But we as a healthcare professional have this problem, and we have to address this problem. This problem can be addressed only by having more institutes, and we can generate more number of people for the healthcare industry. Burnout, as I said, burnout is the biggest problem. Day before yesterday, 2 ICU doctors came to me and they said that we are leaving. Why we are leaving? Because we are working for 12 hours every day. And then thereafter, our department head asked us to do overtime. Fine, to doctors we don't pay overtime, we give them compensatory off. But the genuineness of this problem has to be addressed. We have started addressing in our hospital. And the only solution is or was, when we discussed last week, is to recruit more number of doctors or train some of the senior nurses who can take care of the patients in case doctor is not immediately available. So we have a program, we are running a program wherein we train 10 to 15 nurses, or started training since last month after realizing that competition is taking employees. That is one part. Secondly, people are getting burnout because they are working for 2 days in ICU, no sleep, nothing. And then the problem starts. Which are those problems? Frustration, taking frustration on the management, taking frustration on the HOD, and then these people leave without giving any notice. Now, in this situation, if you see from a humanitarian point of view, or if you give the consideration or priority to the humanitarian part first, then those doctors are right. Because they are working 12 hours, they are doing overtime again, means they are extended working hours after 12 hours. And we don't have doctors. And it is not that industry is trying to get doctors from various states in the Maharashtra. But again, there is a dearth of doctors. There is a dearth of nurses. Kerala only give maximum number of nurses, as I said. Doctors come, but majority of the doctors prefer to go to either south or the north of India. Big hospitals are there. They are well-known hospitals. And they always appoint the doctors or the healthcare professionals by paying them a very high salary. So I have only 10 minutes left. I'll try to rush this. Employee turnover, which is what I already addressed, because the number of employees who are leaving the organization, the rate of nurses leaving the organization across the city of Mumbai is average 32 to 35%. Doctors around 12 to 13%. But why doctor leave? When you have such a fantastic institute, I'm talking about the Jaslok, or for that matter any other institute like Apollo, which is a corporate across the Asia. But people are leaving because of the burnout. People don't want to continue. And recently there's a trend that those who are doctors, their kids doesn't go to the medical side. They prefer going to other side basically because they see every day in and day out, their parents are going at odd hours to hospital, treat patient, and on the top of it, there are certain people who hit them, and all those things are happening, which are unethical things. And because of that, many people are not going for the medical profession, in spite of their parents, because that was a trend in the past. This is one more thing which we have faced, and one or two of other hospitals in Bombay have faced. People go on Google. Google gives a lot of information which is correct and a lot of information which is not correct. So people go and check the review, and if some disgruntled patient has put negative remark, the student only catch that, or the candidate only catch that particular comment, and basis that he or she takes a decision, don't join the organization, irrespective of you are paying high salary, irrespective of you are paying more than market, but people don't come to the hospital. So this is one big problem, maybe because of the social media. One more thing which I was talking about with my colleagues yesterday, hospitals are changing their softwares very frequently, because the demand from patient is totally different. The requirement of the time is totally different, and technology can only help. But at the same time, old hospitals wherein people are working for last 30 years, 40 years, 3 decades, 4 decades, they are not in a position to adopt that technology. We have invested almost 1 year to train old employees in getting customized or familiarized with the new system, new HI system, hospital information system. We took almost 1 year. So it's very difficult, and it's unfair on our part to expect a person who is going to retire 2 years down the line, has never touched the computer, or even if he or she has touched the computer, it's for basic things. And to expect them to adopt the new technology is very unfair. Now, what are the newer trends? Because we need to have doctors, nurses, whatever may be the situation is which we discuss, but we need to have, because we want to treat people, because it is fundamental right of the citizens of this country. So employee value proposition is one thing because of which we are trying to at least address this problem. We are trying to retain the people. It doesn't work 100%. It's very easy to say over here. It's very easy to implement also if you are a professional or expert in that. But in reality, it's very difficult. So one has to take care of this. We have started working on this. So human touch, which goes without saying, because the industry which we all work for or you are going to work for is the industry which deals with the emotions of people. So hospital is a industry which deals with emotions. It is not a theater, it is not a garden, or it is not a mall. So when the person enters, the employee has to be very polite, has to take care of each and every query of the patient who is admitting. So that human touch has to be there. And towards that we have started working last year during COVID, second COVID wave. And we have realized after 1 year that has started giving results to some extent. And in the area of doctors and nurses. Rest of the areas, if you ask me, people are stable that way, back office people and others are stable. Then the earn and learn concept. No, one slide has got skipped. Take it back. As I said, employee recognition is one thing. I was trying to tell you about the employee retention, and employee recognition is one of the best thing which you can have. At least you can save the attrition rate to maximum 70%, and that is what has been tested by us in Jaslok. So around 70% of the employees stayed back when we started the recognition program 2 years back in spite of having COVID. So this is the very powerful tool which one has to always implement in the organization or hospital. Please ensure, as a student, when you will join any hospital, please ensure from the day first that everybody is satisfied. Address the queries, talk to people, counsel them. Last slide. Yeah. Because that really helps. So I have finished my presentation. What are the key takeaways from this program? Understanding the prevalent challenges which we have seen and the trends. The trends are answer to the challenges but need not be applicable for each and every industry or each and every hospital. Second is application of technology in making future workforce, which I talked about that in my second last slide. And there has to be a methodology to bridge the gap. So before I conclude my presentation, I would like to wish you all very best, and it's over already. So I will say Shubhaste Panthana Santu. How many people know Sanskrit? How many people have studied Sanskrit? I don't know. But while concluding the session, I would like to say Shubhaste Panthana Santu. That means may your path to the future be glorious, and all the best to you all. Thank you very much. Because of time constraint, I could not speak. Thank you.
Thank you, sir, for enlightening us with a valuable session and stressing out the importance of healthcare force. Now, we open the session for question and answers.
Due to the lack of time, we can only conclude with one question. Ladies and gentlemen.
Hello.
Yeah, you can go ahead with questions.
Yes, sir.
You need a mic.
So you took a very relevant topic of rural and urban deficit. I just want to put in a suggestion.
Can you raise your hands up? Who's talking? I'm sorry. Okay, please go ahead.
Sir, as you said that the doctors are more in urban population, same is for dental care too. And then you said that Ayush population is higher in the rural area. Don't you feel that with a higher rural population of around 90 crores, there should be some sort of a bridge gap for the deficit completion and to ensure that you also said that you are training your senior nurses to fill in for doctors wherever required. Don't you feel that there could be a bridge gap wherein you can use the capability and enhance the upliftment?
Yes, I fully agree with your question. It's a good question. And that's why government has started deputing last year MBBS student in the rural areas. But at the same time, government has given option. It is optional. Whether you pay that X amount to government or else you go to the rural area and serve for 1 year. But the question is correct that there is a need to bridge this gap, and that gap can be bridged only by the rules and regulation if government makes it compulsory. As a healthcare professional, when you are working or we are working in a hospital, it's very difficult to say X that you go and work in XYZ rural area. It has to come from government as a practice of last year's internship, which is there but which is optional, so of no use as such. Well, I have seen people paying 2 lakh to government of Maharashtra and saying no for the rural posting. So government has to make it compulsory. Please, madam, sorry.
I must congratulate you on your initial discussions on such an important topic. These conversations are taking place all over.
Yeah.
I just wanted to bring to the notice of this August gathering that yes, we talk about nursing being a very difficult population to really, to retain. That is a very important task for all healthcare managers. But what I wanted to bring to the notice of the administration, various hospitals, that we have a huge task force of allied and healthcare professionals. They are really not utilized in a particular hospital. So I find in the dialysis centers, nursing staff is doing most of these procedures, even in the ICUs, where respiratory therapists could really, take up this work. Even in OT and anesthesia technologies, they can take up the work in operation theaters. So could you just, give your views on this?
See, there's a concept of privileges given to the doctors. But what happens most of the time, as you rightly said, in certain areas like dialysis, for that matter, operation theatre, the technicians, by virtue of experience, they become more skilled than the doctor or than the nurse. And in that area, I have seen in many hospitals already technicians or the nursing staff, they take care of the patient. So it is like they get trained because of the experience. So after 30 years, the operation theatre person, he opened the chest and then doctor comes only for stitching the nerves, nothing else. But you are right that they should be given a formal education, because I have seen in many hospitals people are there who are doing fantastic and phenomenal job than doctor. Nothing against doctor, but I am just saying. But they should be given the formal training. Then only there will be some help to the organization or to the hospital and to the patient ultimately at the end of the day to tackle the problem in time. You're absolutely right, madam. Yeah, please. They will need mic. There are 4 or 5 on the back side. Okay, I will come forward.
When we all talk about shortage of doctors, I think we are talking about junior doctors.
Yes, but they are.
The reason we don't have junior doctors is because in our countries, after your post-graduation, you make them specialists. We don't want them to go, it's nowhere in...
No, there is no gap. Immediately they start the second course.
So that is what we have to address, that you can't be a specialist just after you go in. You have to do some trainings for 5 years, 10 years, only then you become consultants. So that will anyway take care of all the problems of shortage of medical staff. It's not that we don't have doctors, we are not utilizing them properly. Secondly, everyone talks about bridge gap, train a technician to do the doctor's work, train a Ayush worker to do our doctor's work, allopathy. Let the Ayush people do their work, let the allopathic doctors do their work. There's no dearth of it. All the specializations are very good. And when they do their work, it's okay. Problem is that most of the people, even our government, most of the MBA...
Sorry, ma'am, to interrupt.
Just last point I'm making. They all talk about bridge courses. Let's make our allopathy a very diluted thing. Let's get an Ayurvedic doctor, give him a training for 2 years, make him an allopathic doctor. That doesn't work.
Due to lack of time, we need to end the session right now. Thank you, sir, for enlightening us with such a valuable session. Now, I request Dr. Samita Jadhav, Deputy Director, Academic Symbiosis Institute of Health Science, to felicitate Mr. Sunil Karanjikar.
Yeah, okay. Anyway, thank you everybody. Thanks to Symbiosis. And what you said is right, that if healthcare want to achieve this Vasudhaiva Kutumbakam, at least for the healthcare sector, then definitely the suggestion is very, very useful and should be implemented. Tomorrow I heard that Union Health Minister is coming over here. The appropriate authorities can put across this point to him. I will address your question in one-to-one because of the time. Sorry, I think two of them also wanted to, but I will address during the, after this session, okay? Thank you.
Thank you so much.
Thank you very much. Thanks a lot. It was a pleasure. Thank you. Thank you.
Thank you, sir. Thank you, ma'am.